Have you ever felt down or unmotivated for no reason? What if something as simple as vitamin D, made when we get sunshine, could be behind it? After UVB exposure, vitamin D is made in your skin and nutritionally found in fatty fish, fortified foods, or supplements. Many adults in the US don't get enough. It's estimated that up to 1/3 are deficient. Low vitamin D is linked to depression. People with low 25-hydroxy vitamin D levels often report more symptoms of low mood. Studies show vitamin D works inside the brain. It helps produce serotonin, our feel-good chemical messenger that helps regulate mood, reduces inflammation, and supports brain cell growth. Low levels can disrupt these systems and may worsen mood. Vitamin D became a significant public health concern in the early 20th century when severe deficiency led to rickets in children. This prompted governments to fortify milk and other foods with vitamin D. But in recent decades, rising indoor lifestyles, sunscreen use, and screen time have caused a quiet return of vitamin D deficiency, even in sunny places. But does supplementing actually help? A 2022 meta-analysis found that vitamin D lowers depressive symptoms, especially in people who start with low levels. People with clinical depression saw better results. Still, large prevention trials haven't shown benefits for those without symptoms. It's not a cure-all, but helps when a deficiency is present. Low vitamin D levels are believed to play a role in seasonal affective disorder, a type of depression that tends to appear during the darker, colder months. Reduced sunlight can lower vitamin D and serotonin levels, which may explain why some people feel more down or tired in darker seasons. While research is still being conducted, vitamin D supplementation may help reduce seasonal affective disorder symptoms in people who are vitamin D deficient. If you think you might be low on vitamin D, there are several signs to watch. Common symptoms include persistent fatigue, muscle aches, bone or joint pain, frequent colds or infections, and mood-related symptoms like feeling down, anxious, or irritable. Some people also notice brain fog, poor sleep, or even hair thinning. These signs may be easy to overlook since they often resemble symptoms of other common conditions, so getting a 25-OHD blood test is essential if you suspect a deficiency. Once you start supplementation, improvements in mood and energy can vary. According to Mayo Clinic and Very Well Health, some people feel better in just a few weeks, while others may need 8 to 12 weeks or more to see a difference. Complete restoration of vitamin D levels in the blood may take 3 to 6 months, depending on how low your levels were and how consistently you supplement. When used within the recommended guidelines, vitamin D is considered safe for most people, but too much can be harmful. High doses over time may cause nausea, vomiting, confusion, calcium buildup in the blood, which can lead to kidney problems. Health experts recommend a daily vitamin D intake of 600 to 800 IU and advise not exceeding 4,000 IU to avoid potential side effects. However, some conditions may require more under medical supervision. Always talk to your healthcare provider before taking high doses. Here's a real case series. Over 50% of patients with treatment-resistant depression who also had low vitamin D levels saw subjective improvement simply by adding vitamin D without changing antidepressants. That means a doctor tested for vitamin D and prescribed supplements, and the patients felt better after fixing their deficiency. Clinical observations and case series have shown that more than half of patients with treatment-resistant depression and low vitamin D levels reported noticeable mood and energy improvements with supplementation, even without changing antidepressants. From a practical point of view, ask your doctor for a 25-OHD test because not every standard blood panel includes it. If you're unsure how to bring it up, try saying, "Could my vitamin D level be affecting my mood or fatigue?" Or, "Would it make sense to include a vitamin D test in my labs?" Being proactive can help you get personalized care and answers sooner. If your levels are low, you can raise them in 3 ways. Spend about 15 minutes in midday sun, eat foods like salmon or fortified milk, or take a supplement. Then retest in 3 to 6 months to track progress. Vitamin D works best when paired with consistent sleep, regular physical activity, nutritious eating, and emotional support. In addition to fatty fish and fortified foods, your vitamin D intake can be boosted by eating egg yolks, beef liver, cheese, and UV-exposed mushrooms. a plant-based source with meaningful vitamin D, as vitamin D2. However, dietary sources often fall short, so testing and supplements are essential. It's also key to remember that mood swings can have many causes. Stress, sleep loss, thyroid problems, or hormonal changes can all play a role. If low vitamin D is part of the issue, addressing it may improve your feelings, but it's usually just one piece of the puzzle. It's not a replacement for therapy or medication, but restoring levels if low can contribute to emotional well-being and strengthen the impact of other therapies. Certain conditions like obesity, celiac disease, Crohn's, liver, or kidney problems can reduce your body's ability to absorb or convert vitamin D. Some medications like steroids, anticonvulsants, or cholesterol-lowering drugs can also interfere with vitamin D metabolism or absorption. There are a few common myths to clear up. First, more vitamin D isn't always better. Taking high doses without supervision can cause harm. Second, while sun exposure helps produce vitamin D, you must protect your skin. Just 10 to 15 minutes of midday sunlight can be enough. And finally, not all supplements are the same. Vitamin D3 is better absorbed by the body than D2, so it's often the preferred form. Discussing personalized dosing with your doctor is essential. People with darker skin, those of older age, those who use sunscreen more, or those who spend most of their time indoors may be more at risk for low vitamin D levels. The bottom line is that vitamin D isn't a cure for depression, but if your levels are low, fixing that deficiency could be a decisive step toward better mood and health. Test your levels, raise them safely, and work with your doctor. That's how you can become your own healthcare advocate. If you found this deep dive helpful, give it a thumbs up and subscribe for clearer, science-backed medical explanations every week to understand your health better. Ask the right questions and make informed choices. If there's a topic you'd like Did You Know MD to cover, please let us know in the comments below.